Good afternoon, everybody. I'm Jared Cleveland. I'm the superintendent of Springdale School District. Today, we are graced with the presence of our president of the board, Miss Michelle Cook, and a special guest, Dr. Gary Wheeler. Dr. Wheeler is a gentleman who has been working for the Department of Health, and his relationship with me has gone, well, I guess, is a long relationship. And he is one of the most profound medical pediatricians in my mind in this state. And so he has agreed to talk to us today, maybe help us understand about this COVID-19 virus and how it impacts children and how we could potentially improve the health of our entire, community and maybe provide a path of safety back to school. So Dr. Wheeler, if you don't mind, would you mind to kind of introduce yourself, give us a little background, and we'll do the same for Ms. Cook in a moment, and then we'll begin our conversation.
Sure. So as you mentioned, I'm a pediatrician. I've done a lot of specialty training in infectious diseases, and allergy and immunologic diseases, and worked at Children's Hospital when I moved to Arkansas in 1991 until just a couple of years ago. I've also worked at the health department for about the last 8 years. Doing outbreak response and general public health issues, and served as the chief medical officer there. Currently, I'm representing myself for this activity as the president of the American Academy of Pediatricians for the Arkansas chapter. I've also served on several of their national committees as well. So that's a little bit of my background. I have 2 kids. My oldest one has worked for the Washington, D.C. school district and currently does as well. Wow. And I'm actually in Washington right now, serving as a child care professional. My granddaughter's 15 months old. My daughter found it a little challenging to work full-time remotely with a 15-month-old in the household. So I'm working remotely with the health department and working as a grandparent here in DC.
That's fantastic. Ms. Cook, would you like to introduce yourself to this whole public that's going to get to see us?
Sure. I'm Michelle Cook. I'm the current president of the Springdale School Board. I've only been president for the last couple of months, and I have been on the board for 6 years. I am a lifelong resident of Springdale. I have 3 children, 2 that attend the University of Arkansas and 1 that is a junior in high school. I am representing both our community from the school standpoint, a parent of a child that will be entering school, both from the public school standpoint and the college arena, and as a former teacher. I've had a lot of teachers reach out to me and with concerns and questions, and I hope to try to reassure them at least a little bit in things that they can, questions they have and things that they can do to better prepare for the school year.
Well, thank you for participating in this opportunity to get to pick Dr. Wheeler's mind and him help us really gather information in order to create better policy, better practice in our everyday life to open up school. Dr. Wheeler, my first question for you, really, which I think will launch a good conversation, and that's really what this is. We just need good, honest conversation that helps us and our community really focus on what us as a group can do to get through this pandemic as quickly as we can. So my first question is pretty simple. What is COVID-19, and how has it impacted us at such a level where the world is basically shut down? And then what's next?
So one of the nice things about living in 2020 is that there's this incredible amount of information that's available to everybody through the internet. I think most of you know that COVID-19 is this unusual virus that we think came out of China, presented there. And it's related to some viruses that we already have in the United States that are called human coronaviruses. The COVID-19 is thought to have come from an animal species, and it has jumped into the human population, and it turns out it's pretty infectious for us. So I think most people are familiar with the facts of how it spread over the last 6 months from China throughout the world and now very intensely in our own country. The other facts that I think most people are aware of are how it has spread and how that's changed our society as we try to respond to it. The virus is a respiratory virus, and it may also infect the GI tract, but it appears that the respiratory tract is the main site of reproduction, both in the upper airway, which includes the nose and sinuses and throat, and the lower respiratory tract, which is down in the lungs. And it's most problematic when it gets down into the lungs and causes pneumonia, but it has other features. It can cause diarrhea and GI illness. It's been known to cause cardiac, heart problems, particularly in adults. But we're also just now learning this weekend that it can do it in children as well, very infrequently. It has caused some immune reactions in children that have put them in the ICU, but for the most part, they're able to recover from that. That typically occurs 2 to 4 weeks after an acute episode of COVID-19. The other things it can rarely do is cause some encephalitis, which is sort of a brain disorder. Again, tends to be transient and passes most of the time without terrible complications. So it's like a lot of viruses that we deal with. It's got a lot of different manifestations. It has its most common manifestations, which are sinus, cold, and sore throat symptoms, fever, achiness. And it's got a couple of unusual things. One is the profound fatigue that you get with it that seems to be on par with what some people experience with mononucleosis. And the other thing is this weird sort of observation that people lose their sense of taste and smell. And that's a very unique feature. And if we encounter that in a patient, we kind of assume that this is probably COVID-19 disease even before the test results come back. So anyway, the other really important thing for this discussion is who it impacts. And we have learned that unlike almost every other infectious disease, this one tends to spare children. We think that's because the virus enters the body through certain receptors that are not very prominent during early childhood and even into early college years. And as a result of that, the virus has a hard time attaching and penetrating the system. So most children do well. There have been rare fatalities associated with this, and we think in many cases those are really related to children's other underlying diseases. But most of the time kids do well. They are uncommonly hospitalized. We've had very few hospitalizations in Arkansas. We've been tracking that very carefully through all the children's hospital groups as well as other hospitals. And all of those kids have done really well. We've had a couple go to the ICU, and that's it, without complications. So that's a really important piece of information. The second one is, and I'll stop, Jared, because I know this is becoming a lecture instead of a conversation.
Actually, it works out really well for Ms. Cook and me that we just sit here and listen. That's great.
The other thing is, because children have a hard time contracting the virus, they also have a hard time transmitting it. And even though there's some data that suggests that the virus counts can be as high as we see in some adults, the evidence is that they very rarely transmit. So we don't know exactly why that is. Maybe it's because kids are smaller, they don't cough, they don't transmit the virus through the air as effectively, or maybe they just have lower numbers of viruses at the time when they're having contact with other people. We really don't know the whole story. But the evidence so far is that it's uncommon for that to happen. And the evidence comes from 3 large bodies of data. One is out of Iceland, where they tracked the genetics of all the virus infections there. They were only able to document a transmission of 2 adults that acquired infection from kids out of their entire population there. The other group is out of New York City, largely data that came out of daycare studies that show, again, a child may get infected at home, they may go to daycare, but they don't transmit it very effectively to other children. And they don't transmit it to adults very well either. So this is a really critical point that we'll get to later on in the conversation, is that the people most at risk in schools from COVID-19 are really adults who work there, who transmit it to other adults who are working there. And that's really an important thing to think about in school planning.
It really is. I feel like you really poured out quite a bit of information that I'm just now trying to digest and figure out. So I'm going to pass it to Ms. Cook. She's gathered some information and some questions from friends, family, community patrons, and they're really good. I think she is prepared to ask a few of those, and maybe it will spur some additional questions. Ms. Cook.
Great. You've already answered several of the ones that I had, but something that a lot of teachers are asking is there anything that they can do to build their immune system before they come back to school?
That's a great question. It's relevant for every infection in the world. There's no question that one's own immunity is almost as important as the environment that you go into where you might be at risk. And the things that are good for your immunity are things that are often hard to achieve these days. Probably the most important thing is sleep and rest. And given everything that we've been living through for the last 6 months, that's been very hard for people to do. And if you're having trouble resting and sleeping, there really are techniques that can help you do better. A lot of meditational things, making sure that you have time alone. One of the other things that's important in immunological health that is impacted by stress is getting outdoors. The Japanese speak of going for a walk in the woods as going out for a forest shower. And the idea that you're walking through an environment that envelops you and cleanses you is really an interesting concept, and I think it makes a lot of sense. So spending time walking, getting outdoors as much as you can. Of course, these days that's in the morning and late evenings, given all the heat. But even those hot physical experiences that you have are distracting and kind of put your mind at rest. And I think those kind of things are really, really important for the immune system. A lot of people talk about diet, and I don't think there's anything special about diet. I know people will disagree with me about different things and vitamins that you can take to improve your immune system, and there may be merit to that. I think just having a good, healthy diet, a cardiac diet is an important thing. Apart from that, there are other things that we need to remember as we move into the fall. When teachers go back to school and parents go back with their kids, essentially, there are other infections that happen in school. And for some of those, we have vaccines. So it's really critical that people pay attention to getting their flu vaccine. It's really important for older teachers who may be my age to get their Pneumovax vaccine, their zoster or shingles vaccines. And the one that really is the biggest bugaboo in schools is pertussis. And all adults should have had a pertussis vaccine. If they haven't, they need to go get one. So keeping those things in mind. And then the final thing is, I'll mention is that many of the things that we are doing to protect ourselves from COVID-19 will protect us from all those other viruses, RSV and rhinoviruses, paraflu viruses that cause a lot of asthma flare-ups. My prediction is we're probably going to see less of that this year because people are very rigid, hopefully very rigid about following our guidelines for COVID-19 in schools.
Let's talk about those guidelines. 6 feet away, or if I'm a teacher, I'm 12 feet away presenting without a mask. What about these face coverings? Do they work? Should they go all the way down to 2? Pre-K kids, elementary kids? And that being said, when you talk about that, also talk about, if you don't mind, what should I do if I'm a child going home after a school day, if I have older mothers and fathers in my home and potentially grandparents? What should I do when I first get there? Do I take my clothes off, take a shower? I mean, what do I do? So
Yeah.
help me through some of those thoughts.
Right. So what I'm going to tell you is a combination of information that's been derived from actual studies and observations, and a lot of it just based on generalized information from other infections that we've studied over the last 100 years. And then the final piece of all that is people's opinions. It's very important that everybody understand that the information we have continues to change. People all over the world are studying this virus, and new information comes out every day. And some of the information we learn from unique situations that create information that allows us to know how this virus is transmitted. For example, in Washington State, there was a choir that got together, and they were roughly 3 to 6 feet apart. And one of the people who came to the choir practice was infected. And there was an extraordinarily high rate of infection in that choir. And from that single example, we learned that singing is likely to project virus particles much farther than it would if we were sitting quietly talking. Now, you can generalize about that, and you can talk about shouting, cheerleading, a lot of other type of activities where your exhalation is at a much higher volume and velocity than it would ordinarily be. And so in those situations, the 3 to 6 foot rule probably doesn't work so well. And there are going to be all kinds of examples where that occurs. This is a little bit of an appeal for a quieter, more milder approach that we take with each other. Less shouting and screaming and more quiet discussion is actually a healthy thing to do for multiple reasons. One, because you're less likely to transmit or contract disease, but also it's better for our, general health and immune systems. Dr. Cleveland, the issue is based on all this collective observation, we have come up with some recommendations. We have not studied these in the laboratory. We have not taken people and put them 6 feet apart, 3 feet apart, 12 feet apart, infected them with coronavirus, and looked to see how many people on the other side of the room got infected. We have not done that. When we usually do science, those are the type of experiments we do. In this case, it's all observational and experiential. And from that, we have estimated that being about 3 to 6 feet away, and the numbers keep changing. It was initially 3 feet. Now it's 6 feet away. Gives us a greater safety cushion in terms of transmitting disease. Now, again, being 6 feet away and screaming and shouting and singing won't do it. You're going to have to be 12 feet away. And you can't play a flute or piccolo if you're 6 feet away. You've got to back away to 12 feet away, because we've learned that the way that you blow air across a flute throws particles out into the room. So some of the guidelines that we put out about band practice and other things address some of those issues. The question you ask is about masks, and are masks effective? There's been quite a bit of talk about why the CDC didn't recommend masks earlier. And again, we're dealing with an unusual virus, and there was a lot of concern about whether masks were actually effective or not. There was some very early preliminary data out of Korea that said maybe they're not effective, maybe they're even more harmful, which slowed down the world's response with masking. In societies like the Asian societies, where they have preferentially used masks to prevent illness for years and years, they put them in right away. And we learned from places like Korea and Japan and Hong Kong that when those practices were put in place, the surge of cases came to a quick stop, plateaued, and began to drop off. So we've learned from these giant social experiments that yes, masks work very well. And there's been also some recent data in the United States that the southern states where masking has not been done early have had much higher rates and much more prolonged surges than states, particularly in the North and Midwest, where masking was done earlier and they've seen more limited surges and spread. So there's really been a consensus developed. The director of the CDC 2 days ago made the comment or wrote a paper in the Journal of the American Medical Association say the time is now. We know that it works. We need to do mask mandates. And I want to say that the Springdale School District was the head of the curve on this because your board, I think, recognizing what the data was showing, voted to mandate masking in schools. And I completely support that, as does the AAP, CDC, and pretty much every other health organization in the world. I think that's going to be an effective way of limiting spread, even if cases come into the school. That's something we all have to recognize, that given the amount of disease that's currently prevalent in Arkansas, and particularly Northwest and Central Arkansas, there are going to be cases that show up in school. They're going to be children of parents who perhaps were silently infected or whatever, and we discover that a child is positive. But the goal of wearing masks, the goal of social distancing, the goal of all the other interventions we're going to talk about is to prevent further spread within the school system. And we've got an advantage over every other sort of indoor setting in that it's largely children that we're dealing with. So their ability to transmit is limited. If we do these simple maneuvers, for the most part, we're going to be very successful, I think, at preventing transmission within school districts. The guidelines that have come from the Department of Education have made the point that a single case doesn't mean you have to shut the class down or close the school. That we expect there will be single cases that come, maybe even a couple of cases. And we may close down a classroom if that happens. But we don't have to close down the school, because if everybody's doing these preventive measures, there shouldn't be any further spread within the school.
Well, do you have some specific recommendations for our school district and others that would be very important for our community to know right now, other than the 6 feet or 12 feet apart and the face coverings? Are there other things that we need to be doing? I know we're wiping touch points, fogging rooms. What other aspects do you believe that we're not doing that we should be?
So schools have for a long time been doing a pretty good job of sanitizing within the schools. There's always been infection there. We've always had flu and other infections. And so I think we've learned over the years to do a fair amount of work to look at high touch surfaces like doorknobs, tabletops, sinks, and that kind of thing, and do regular sanitizing in those areas. I think the same rules apply to COVID-19. Perhaps we need to be a little bit more vigorous with our sanitizing, just to make sure that we're thorough and that we are regular with those activities. I think the school districts across the state are planning to do those kinds of things. The evidence that people acquire infection from those kind of situations is not real strong for COVID-19. It does probably happen, but we really have very little evidence in the literature that that's the way it happens. The most important things, or the most important ways that this is spread, is by respiratory droplets. So the masking and the distancing are very important. The other thing along sanitizing that I wanted to talk about is hand hygiene. That probably is a little bit more important in that kids rub their noses, they shake hands with each other. We do the same thing as adults. So it's really important that there's availability of some type of sanitizing agent for the hands. 70% alcohol gel is the most common thing that's been used across the health industry. There's been, I think, some concerns in nursing homes and maybe even schools about using alcohol. My experience, both in the nursing homes and in school settings where this has been done for a while, is that it's typically highly successful without kids abusing it or drinking the gel or anything like that, which is a hypothetical fear that I think has not been real common. But there are other agents that are out there that are equally effective. So making sure that those are available at the entrance to every classroom, around all the sinks, places where you eat, and that there's an abundance of that, I think will be really important. And the bonus of this is when we have all that available, kids will grow up learning to do that, which will be fabulous. And it's a life skill that they need to keep from getting sick in the future, regardless of what type of germs are present.
Well, I apologize to Ms. Cook. I've been dominating. So, Ms. Cook?
I want to switch back to the mask for a few minutes. I have some of my teachers have reached out and asked whether or not they can wear face shields, the clear, so that the students can see their face. If they wear those, do they need to wear a mask underneath, or does it matter?
So this is a little bit of, there's controversy around this and the data is not clear. The limited data that we have shows that face masks are better than shields. That if you want to use them together, then you probably have an additional level of protection. The other thing is there's all kind of face shields, and some of them allow air in at the top and at the bottom, and those are probably not very effective for, if you will, the airborne issues around COVID-19. They're better than nothing, and there's some data that shows that they're better than nothing. And there are unique situations that are involved in language skill teaching and that kind of thing, and where it's really hard for people to communicate without seeing their lips and that kind of thing. I really don't know how to, this is one of those cases where virtual learning actually may be better than in-person learning for some of these things. And I think that I had some discussions yesterday with an elementary school here in Central Arkansas that was planning, and I had probably 30 faculty members and the nurses and the principal all Zooming together. First of all, I want to say it was really a heartwarming experience. I think my regard for the teaching profession continues to go up and up and up. And the way that people are preparing for this back to school situation, I think is sort of a testimony to the American grain of, yes, we can do this. We can figure this out. This is hard. There's really no other options. We're between a rock and a hard place. We've got to get our kids back to school so they can normalize and learn again. And we're just going to have to figure out ways to do it. So the way these teachers were talking about that exact question and figuring out ways to, they're the ones that brought up the point that virtual learning may be the secret to that. And it can be done in the school, that you've got, a teacher in one room and a child in another where they're working on their computers with headphones to try to acquire those skills. So bottom line is the face shields are not as good as masks, and my preference would be mask or working in a separate area virtually. Face shields can be added on for certain activities if needed, if there's concern about that. Now, again, we've talked about 6 feet, 12 feet, how far away can you be without a mask, without a shield? And that brings up another issue for you as president and superintendent, which is the issue of ventilation. So one of the things we know that if you're in a closed space for long enough with somebody, sometimes it doesn't even matter how close you are. And again, one of these studies that was done in a Chinese restaurant showed that the people that got sick when someone entered that restaurant had nothing to do with where they were in physical relationship to each other. It was just that they were in the restaurant, and there was no outside air exhaust. It was a very cramped, small space, and the viruses just had nowhere to go. So if you're a teacher and you're in a classroom for a long time with an individual, the fact that you're 12 feet away is probably pretty good, but it's not 100%. And so wearing masks is probably protective for both the students and the teachers as much as possible. And I know that's hard. It's hard to talk through the mask. And again, the courage and energy that I got from the group yesterday was really heartwarming. But also being realistic. This is going to be a long haul. I don't think that we're going to see relief this school year. We may, and that would be great. But I think probably through the fall and spring, we're going to have to maintain this is our new way of school life for a few months. So people are going to get tired. They're going to get fatigued. They're going to get discouraged. But we're going to have to do what we've always done as Americans, whether it was at Valley Forge or World War II or after 9/11. We're going to have to put up with some new inconveniences, but we're doing it for our kids. And it's something that we've always done, and people who have chosen this as a profession understand that there's always been sacrifice associated with teaching. It's a different kind of sacrifice now, but it's one kids need worse than ever, because I think for those of you who have kids and have counseled children, you know, it's been a tough spring. So getting back to school is a huge plus for everybody.
There's been a lot of talk about how to rearrange their classrooms, and then whether or not to, once they go home, I know we touched on this before, but whether or not, taking their clothes off and changing clothes before they walk into their home. I know some doctors do that. Is it something that teachers should do as well? Have a set of clothes for home and make sure that everything that was worn at school is taken care of, right away.
Yeah, I think that
they should worry about.
Yeah, I think that depends on what age kids you're teaching. I think the very young kids, the preschool and K1, there's a lot of physical contact between teachers and students, and that it may make sense to do that, what you've suggested. I think for older kids, it's probably not necessary. Again, I think that we use the term fomite. A fomite is any object that can be a vehicle for carrying a virus from one individual to another. So clothes or physical objects are fomites. There's very little evidence of, again, fomite spread. So I think you have to do what makes you comfortable. That's really important. The mental health of teachers and other staff is really critical. So do whatever makes you feel comfortable.
I know you're a pediatrician, so your focus is children, but it seems like your focus now is really all people, because this COVID-19 has impacted us all greatly across the world. The questions that we received today about opening school, some of the opinions might be political, meaning, the economy needs to get going. We need a place for kids to be. That puts teachers in a bad position. That's the political mindset. From the other side of it is, we have children who are in poverty. We have children who live in multifamily homes. They may be safer at school. But the fear of the multifamily homes and the children being impacted by multiple adults who are out working in various markets, coming home, potentially carrying the virus to school, to the staff. Do you have any advice for the moms and dads and families who are at home, maybe living in with multiple families due to whatever reason? Do you have any advice for what they can do at home to lower that impact of that virus potentially spreading?
So there's two principles. One is you want to shrink your social circle as much as possible. And in a multifamily home with multiple people working and going out of the home, that's really hard to do, but you do the best you can. And limit social engagements as much as possible so you're not exposed to too many people. I want to remind everybody that we've only had about 1% of our citizens in Arkansas that have been infected. So 99% have not. Most of the people you encounter are not going to be infected. But to limit the chances that you run into that 1% person when they're infected, you try to shrink your social circle down as much as possible. the question about, the other question that's sort of linked to that, Dr. Cleveland, is the issue of intergenerational families, people that have grandparents that are living in the home as well. And we know that those people are at the highest risk of mortality and hospitalization if they get coronavirus disease. That's a really hard one. That is really a struggle. And I don't, I think it is the middle generations who bear most of the responsibility there, and less the children. The children, as we mentioned before, are less likely to bring an infection home and spread it to a grandparent. It can happen, and I do worry particularly about teenagers and college-age students. But it is the working adults, the parent age group, that tend to get infection, to become symptomatic, and to spread very, very effectively. The other aspect of, I mentioned limiting your social circle. The other one is sort of what you do outside of the home, when you go to the grocery store and you go to all these other places. I'm very heartened that the governor has made the decision to mandate masking in Arkansas, which happened yesterday, and will go into place this coming Monday. This is sending a very important symbolic message to the people of Arkansas that, this is very serious. We have to pay attention to it. And I'm hopeful that there will be fewer people in stores. Of those that are there, they'll be wearing masks and keeping distance. It's very important for families at home, when they leave to go to the grocery store, drugstore, hardware store, whatever, to try to find times when they're not busy. Don't take your children there. Go in by yourself, do your business, and get the heck out of there as fast as you can. Wear the mask, wash use alcohol gel after you get out of the store, in case you've handled baskets or other things that other people's hands have been on. Those are the main things. And then the final thing is sort of a mental health thing about how do you manage fear. I think that all of us have probably woken up at 2 a.m. In the last few months, worried about a family member or yourself that might have been exposed or might have had a situation where they could acquire this disease. And what's going to happen when the hospitals are full and there's no place left to go? We've all woken up with those moments. I think right now, managing fear is done by recognizing what you can do as an individual. And it's always been that way. When you go out on the highway, there's a chance that somebody's been drinking, is going to cross the line and hit you, and there's nothing you can do about that, other than to be very alert, pay attention, and do everything you can to prevent an accident. Same thing with this. You've got to be rigorous about wearing your mask when you're out, and keeping social distance. If you do that, and it's, the truth is, these things are not that hard to do. They're relatively easy things to do. It's hard to remember them. It's hard to get in the habit of doing these things, but we all have to help each other do that. And that's why I think the mask rule mandate that was passed will help us all move in the right direction. I'm very grateful for the governor for doing that.
Ms. Cook and I were talking the other night after the board meeting, and I think maybe some others were around. We talked about, do the masks have to stay on all day, or can there be an opportunity for significant breaks? And how do you know when it's time to take a break?
Yeah.
And what are the dangers of having one on all day and not taking any breaks?
Right. So there's a lot of it's aesthetics. People get tired of wearing masks because you do get stuffy, and some people more than others when they wear a mask. There's some people who have underlying physical issues. They may have heart failure, other kind of diseases that really make it a struggle to keep a mask on. Those people should probably not be in public spaces, to be honest with you. If they can't keep a mask on, they may need to find another place to be. As far as, there are minor things that can happen. You do need to wash your cloth mask every once in a while. They can get a little grody, going several days in a row. but masks tend to tolerate it. It doesn't interfere with their effectiveness. Throwing them in with a regular wash with your socks and underwear and everything, and cleaning them up is important. I don't really think there's any other significant downsides that have been associated with masks at this point. People who wear glasses will notice that they get fogged up, and that's a little bit of an issue, and kind of learn tricks to that. Sometimes you get the mask with a little metal band to minimize the humidity coming out of your mask up into your glasses. So there are these little things that we've got to learn to adapt to. I will say that as a medical professional, I've been in situations where, I've worked in units where, or at times where I've had to keep a mask on essentially all day. And it's not easy initially, but you do adapt to it. In terms of taking them off, is it safe to take them off? Well, the best rule is to go outside and take them off. If you can find a way to get out of the building for 5 minutes and breathe some fresh air, and again, do a little of that forest shower experience, that's a good thing to do. It's a replacement for the smoke break that so many people have used in the past. So if you've still got that built into your school schedule, then that's the time to go out and take a mask break.
So bottom line, is it safe for me to send my son back to school?
Yeah. So there's two questions there. Number one, is your child healthy? And if your child has medical issues or other things that you're concerned about, I encourage you as a parent to talk to your doctor, or pediatrician, family doctor, or whatever, to decide whether whether the benefits of going back to school are worth the risk for that individual child. And that's not a decision that anybody can give other than the parent and that child's physician to make that decision. If your child's otherwise healthy, I think that kind of as you alluded to earlier, school may be one of the safest places the child can be. Because otherwise they're at home, they're going over to the neighbors' houses and potentially becoming infected there where there's not necessarily regulated play. Older kids get out even further on their own. And so, the several hours that they're in school is probably one of the safest places they can be right now, where that you've got a mandated mask environment and people are keeping appropriate distances and there's people watching to make sure that they do. So I think it is. There are certain exceptions, I guess I would say, which is it depends a little bit on how badly infection is spreading in a community. And I think that, the White House guidelines on school restarting, as well as others, have been that we see decreasing numbers of cases and decreasing percentages of positive tests. The governor has the discretion to delay school further if needed, depending on how things go. I'm very hopeful with the several weeks left that we've got between today and our start date that's currently already been delayed a couple of weeks, that we will see those numbers start to fall. We have passed Memorial Day, we've passed July 4th, so hopefully people have gotten it out of their systems to go and gather and have these big events and can kind of settle back and be reasonable now. And then with the masking ordinance, I think we should hopefully see a drop in our case numbers, which will make it appropriate, following everybody's guidelines, to restart school at the appropriate time that it's scheduled now.
That's good. There any more?
I think he's answered all of mine.
Well, I've got a couple more. If that's okay. I just didn't want to dominate some more. Okay. Important question. We have a gentleman who works for us named Rick Schaefer. He's Mr. Baseball, Mr. Razorback, Mr. All of that. Is it safe to have athletics? Is it safe to have dance teams? Is it safe to participate in these extracurriculars? Because quite honestly, Dr. Wheeler, many of our students may not come back to us if they don't have those opportunities. So is athletic competition okay? Is dance competition okay? Are all these extracurriculars that students attach to and that we adults love? Is it going to happen? Can it happen? And is there a safe way for it to happen?
So, you know, it depends whose benefit you're trying to achieve. As a society, we know that what we've observed in the last few weeks is that most of the new cases are happening in very young people because they're getting together and they believe they're immortal and they not following the rules necessarily, and they're interacting with each other at pretty high levels. And most of those people are doing okay. But the number of cases that result from that and the secondary cases that occur among parents and grandparents and whatever is the big issue. So one way to ask the questions is sports safe for the rest of us? And I think there's some concern about that. There are some sports that you can play without really violating the issues around social or physical distance. Things that are not big high school sports like badminton and that kind of thing. Or tennis is a relatively big sport in some schools, but again, the big things that are drivers are basketball, football, volleyball, softball, etc. I think it's going to be different. Some sports are clearly safe to proceed with, others are not. The Department of Health has been putting out regular directives on when we think it's time for regular types of sports to proceed. I think the reality is for this fall that it's probably not going to proceed for the main contact sports unless we see a dramatic drop in cases. And that's probably not going to be any individual decision by a school district. I think the Arkansas State athletic bodies, as well as the governor and the Secretary Key, are probably going to have a lot of input on that, along with the Department of Health. And that, it's not just that, it's like I said, dance team and band practice and whatever. The current directive on band practice will allow it to occur, but, part of the reason for having band practice is so that you can play games or that you can, perform. And most of those performances have typically been indoor settings which would be considered sort of mass gatherings and where the musicians are compressed together more than 6 feet. And, you can go out on a football field and you can spread people out and you can have a band practice. So a lot of the goals may be different. It may be more musical education and experience. And that can be done in a lot of settings in a positive way, at least as far as band goes. As far as athletic teams, again, the focus may be on physical development and skill building, which can still be done. You can still learn how to punt, pass, and kick and compete that way without necessarily having, full-scale scrimmages and games. So I think this is going to be one of those sacrifice things, something we've had to do throughout our history. If you go back and look at all the college football records throughout time, you'll notice there were a few years where there was no college football. It was during World War II. And this may be one of those times where we're going to lose a year. But I don't want to predict that. I again, hope that we can see a dramatic turnaround on our case numbers, and it may be possible in the future that we can have a few games this year. But I don't think we're going to be starting on time.
I would love that too. Okay. Pediatrician knows a lot about not just the body, but the human condition, the psyche of the child. Help us maybe create some ideas, or at least some opportunities to have some popcorn things among our staff to say, okay, if we're not going to have some of the normalcy of the world that we all really now miss, that we took for granted, right? Not too many weeks ago, months ago. What do we do to help people's psychological or their heart or their mind and their social and emotional well-being. Are there some tricks from your perspective as a medical doctor, maybe practices we can begin to implement in the learning of children and adults and staff? Are there things that we can do to help people socially and emotionally that we haven't been doing that we should be doing?
Right. I think one of the things that's been missing a little bit is the thing that helps you get through these things are that you know you're doing it for the greater good. And we haven't appealed to that as much as we should, in my mind. I think, frankly, the great enemy out there is COVID-19. It's not another country's military. But there's nothing more patriotic to do right now to help our country than to wear a mask proudly and know that you're doing your part as an individual. That's how we won World War II. It wasn't just the soldiers, it was the people back home who were giving up meat except for one day a week, that were, we had rationed gasoline and we gave up most of our travel. We're asking people to do this. And I think if people feel part of a greater operation that they're a piece of, I think that helps a lot. And we probably need to do more encouragement along that way. I think the classroom is a great level to have that discussion with kids. And as a superintendent and president of the board, I think those are, I know that you guys are doing that anyway, because I know how you operate, and that's something good leaders do. The second thing is acknowledging that people are going to break down every once in a while, and to have permission to do that and resources to be available to address that is really important. And again, I know mental health services in schools and for children is something that we were working on as the American Academy of Pediatrics before COVID-19 came, because we know that Arkansas is a particularly, there's a lot of mental health issues in the state and not nearly the services that we need. But that sort of emergent care that we all provide, and I shouldn't be talking to either of you about this because I know teachers do this every day. I would just say, keep doing it, realize that it's going to be a little bit more than usual, and keep doing what you do best.
Ms. Cook, do you have any, because we're about to run out of time, do you have any parting questions for him or thoughts or anything you'd like to share?
I just want to thank you for taking the time to talk with us. I think your words and your wisdom is just going to reassure our parents and our teachers. And I know parents and teachers both are huge planners in how for the school year. And this has been an odd year in that every day has changed. Something's changed. So I think some of your thoughts have given both me as a parent and my friends that are teachers and that work for the district, you've given us some ideas and some thoughts that we can work towards and start working on. And that helps kind of set us and set the tone for what the school year is going to look like. And I just appreciate your time and your words of wisdom. Thank you.
Well, I want to really thank the school district and Michelle, you and Jared both, for your leadership in moving the school district forward. I had a longer conversation with Jared the other day about the things that are being done in the classroom to prepare for the pandemic. It was really impressive. As I mentioned earlier, the professionalism in this state that's brought to bear by teachers and administrators and other staff is really exceptional. And I feel like people are rising to the challenge, and it's not going to be perfect. We're going to have some fumbles. We're going to have some small outbreaks, hopefully, but hopefully the greater good will be served, and kids will make it through this, teachers will make it through it. And hopefully by next year, and maybe even before, we'll be able to kind of get back to normal.
I think that's great. Thank you so much. There's
Thank you both.
something I'd like to share before we sign off, and I'd like to ask if you would continuously, as we have questions, maybe provide some of your time to help us understand and process and maybe set a better path or a straighter course for success. Would you mind to do that in the future?
I'd be happy to. As a pediatrician, I have the same mission that you do. Children are a treasure that we need to pay attention to, and we need to honor every child's needs. And the AAP has for 90 years done that, and we will continue to do it in the future, just like teachers have done it for several hundred years, centuries.
Well, thank you so much. Is there anything that you would like to say and any wisdom you'd like to share that we haven't touched on today that maybe we should have?
No, I really don't. I think we have an enormously talented profession in the state. I think just don't be afraid to be creative. Don't be afraid to be flexible. Be prepared for things changing. It's going to happen. Different guidelines, and don't be disarmed by that. We'll get through it.
Well, I think the greatest innovation that's ever come has come when pressure was placed on the United States. And we've tended to, in our history over time, become way better than we were prior to that pressure, whether it be a world war or now a pandemic. So innovation is occurring in Springdale, Arkansas. Community is developing in Springdale, Arkansas among our faculty and our administration and our overall community. We're seeing people of all generations, of diverse backgrounds, cultures, come together for this one mission of trying to really to beat COVID-19. So, Doc, I just ask for your continued thoughts and prayers and all of those things that we need, and we're going to provide those with you. I know that you have tremendous pressure on you as well as someone who's trying to help the overall population of Arkansas. And for that, we have a great deal of gratitude. Thank you so much for your time. It is very precious to us. You have a wonderful day.
All right. Y'all take care.
Thank you.